and contract awarded today, $131 million, 5 companies, 3M, Honeywell, Owens & Minor, Boldex, and Draeger. The CARES Act was signed before March was end, right towards the end there. So we're essentially 2 weeks from that money being put in the Title III authority for DoD. This action takes us from a baseline of what was being produced domestically of about 30 million masks, upwards to, as we go through the fall into the winter, 120 million masks domestically. So currently we're filling some of that demand from overseas sources, right? And so the additive masks here through this will ramp up, lower dependence on overseas sources, and that will essentially secure a big piece of supply chain. 5 companies, 6 cities, Smithfield, Rhode Island, Phoenix, Arizona, Del Rio, Texas, Lexington, North Carolina, Sheboygan Falls, Wisconsin, and Aberdeen, North Dakota, all either producing more fabric or increasing production facilities to have that ramp up.
Thank you, Admiral. And can we put that slide? I guess it's still up. This is for just the week ending April 11th. We have distributed or directed the distribution of 5.3 million N95 masks, 5.5 million surgical masks, 110 million gloves. We share that mostly just to make sure our healthcare workers know that the resources are flowing. We're going to continue to flow them, but this is just the numbers for this week. And don't include, for instance, what the president announced. I was able to tell Governor Tom Wolf of Pennsylvania today that next week they'll be receiving 2 million N95 masks to support some of the healthcare challenges that they're facing in the broader Philadelphia area. So with that, we will be happy to take a couple of questions. Go
Thank
ahead.
you so much. One for the Admiral and then one for Dr. Fauci, if you don't
please.
mind. For the Admiral, wouldn't it have been useful as you're going through, all of those supplies that are now making their way into the system? You talked about having to buy foreign products, as we're catching up and making it. Wouldn't it have been useful if it had taken until mid-March for the government to start placing bulk orders for these kinds of supplies?
So I came over from the Pentagon the 20th of March, so I'll speak from the 20th of March on now. We're using the Defense Production Act. I think you'll see much more use of that as we go forward. We make.
My question is about the timing here and
I
that
know,
lost
and
time that the president
I'm not equipped to
denied.
talk about other than from about the 20th of March forward. I was over the Joint Staff. I wasn't involved.
Okay.
Ask Dr. Fauci. You said that you'd be, giving the president your recommendations, you and Dr. Birx coming up with a plan that you guys are comfortable with. Are you willing, once the president has made his decision, are you willing to come here and tell the American public what you actually had recommended to him and whether he followed through with what you recommended?
I'm not really, what do you mean?
So when the president stands up here, whether it's, May 1st, whatever day it is, and outlines his plan, are you willing to stand up here after him and tell the American public what it was that you had recommended he do if there is a difference?
I have to think about that because, when you have conversations with the president, sometimes they really should be confidential in what you give him because he's going to have to make his own choice. I'll have to think about that.
So that way we would know whether he was actually listening to the health advice that he's being provided.
Yeah, he is. I mean, I can tell you one thing, he'll listen. But I think what's going to happen, I don't know for sure, is that he will get input from a number of individuals representing a number of aspects of society. One of them will be a health. The only thing that I can tell you is that I will give him the advice based on evidence, my observation of what the best public health approach would be.
Dr. Fauci?
Yeah.
Just to go back to where we started today, which was with the president's seeming frustrations with some of the reporting about his early decision-making process in January and February. As I'm sure you know, the reason we in the press do that kind of reporting is so that the next president that comes along and has to deal with the pandemic learns some of those lessons. Having watched this unfold up close, what do you think were the mistakes that were made early on that a future president could learn from, with the benefit of hindsight, of course?
You know,
There's no president gets
Yeah.
it right, obviously.
I understand. I don't want to use the word mistakes because when you're in the fog of war, when you're doing something, you have to make decisions. You get input from a number of individuals. It's always a moving target. And I just don't want to have anything taken out of context because I already had one of those already in the last couple of days. So I don't want to go through it again. I wouldn't say mistake. Could things have done better? Of course. I mean, nothing is perfect, and you could always do better. But I mean, I hesitate to say something is a mistake.
With the benefit of hindsight, with that caveat, what could have been done better?
Well, I mean, I can't comment about anything outside of my own field, but the thing that when I think back on was evolving in my mind was something that was a virus that was much worse than what I had thought it was going to be, based on what we had learned early on, when it was first felt to be something that just jumped from an animal to a human. And really didn't have much capability of going human to human. And then all of a sudden you find out that not only was it not just animal to human, but there were a lot of, that's probably the way it started. But then as you go back and you realize there were probably a lot of infections that maybe if we had dealt into that a little bit more, we could have learned that not only is it infecting human to human, but it's transmitting really efficiently. When I question myself, I'm not perfect. Maybe I wouldn't say made mistakes, but maybe I should have really tried to delve into that a little bit more about what was going on, but the information wasn't as forthcoming as I would have liked. And then all of a sudden, when you find out that you're dealing with something that is not only what had been your worst nightmare, because people ask me that, what is your worst nightmare? A brand new virus that's respiratory transmitted, that has a high degree of transmissibility, that has a high degree of morbidity and mortality. You know, is that a mistake? Maybe I should have been able to realize that earlier. I'm not sure it's a mistake. It was just an evolving thing that we finally realized and said, whoa, this is really worse than we could have imagined.
All right, last one, guys.
About one more. When you met with Abbott Laboratories today, what did you ask them to do? What did they say they could do?
Well, we spoke with Abbott Laboratories today about how we can increase significantly the production of cartridges for the 15-minute test. Because remember, we're not only scaling to rapidly expand testing across the country today, and it's one of the reasons why you heard me and Dr. Burke say that we have an entire team now that's going to be working with governors and with laboratories around the country to identify the machines that already exist today and that could be activated and doing tests. But we also want to work with Abbott Laboratories for the longer term, because if the current trend lines hold, and I hope and I literally pray that we will soon find ourselves on the downslope of the coronavirus in this country. This epidemic in its current form will come to an end, but as we make decisions and in the days ahead to reopen America, what President Trump also wants to do is have a policy in place to stay open. And having the kind of surveillance testing available around the country so that CDC can do the immediate contact tracing when you have a positive test, so that we can deploy resources like the new Abbott 15-minute test specifically to nursing homes. We spoke today to Governor Baker in Massachusetts, Governor Hogan in Maryland, both of whom have been very innovative implementing federal guidelines for preventing the spread of infectious disease at nursing homes, and we commend them for that. But being able to increase the manufacture of those devices so they can be deployed going forward in the months ahead is also a focal point of our efforts. So rapidly continuing to expand testing today. And the governor of Louisiana told me today that they had tested at the highest per capita, according to his numbers, of any state in the union. We congratulate him for that. But making sure that going forward, we'll have the infrastructure of testing all across America to deal with the coronavirus should it return in the future. With that, let me bid you all a good evening. We will be back tomorrow. And
Vice President, I just have a question about these cartridges and this timeline, because the New Hampshire governor says the federal government is in charge of distributing those, FEMA is. So what is the timeline for when they'll have enough of them? Because they say they don't have enough, Illinois said they didn't have enough. So look, what's the timeline that you're working with?
yeah, let me let Dr. Birx address that, but there was an initial tranche that we purchased. There's some 18,000 Abbott Laboratory machines around the country. And FEMA acquired a certain amount that were immediately distributed across the states. But now Abbott Laboratories is literally producing some 50,000 a day. Those are available on the open market. And we're also going to be working with Abbott and with the states to deploy those resources. And we're also working with other manufacturers to increase the production of cartridges. But if there's more to that you want to
No,
add,
that was
Deb, we'll make it the
perfectly
last.
said. I just want to, sometimes you ask these questions, and I just want to make sure that people understand. So a third of them went specifically to Indian Health Service and these states that have smaller epidemics. 2/3 of it went into the public market, mostly targeted to the places where there's high disease. But only 2/3 went that way so that people could purchase them directly, and 1/3 went to the Indian Health Service and to the smaller states that really need these. And so I think what we're trying to do now is balance the entire testing framework of medium, low, and high throughput machines to give everyone the maximum flexibility state by state based on what the needs are at that moment. If there's an outbreak and you have to do 5,000 tests, you're not going to do them on an ID Now machine that takes 15 minutes for every negative, but you're going to do it on your high throughput machine. So making sure everybody knows where everything is and what is being run will be really critical moving forward, because we can't leave anything not on, everything has to be on the table in order for us to be able to dramatically increase testing. Yet another, we went up by a log in 3 weeks. So if we're going to increase again, it's going to have to be getting every piece of equipment on.
Let me just again say thank you all for your time and attention, and thanks to every American who's joined us tonight. And I just want to encourage you, we're going to continue to lean into this effort to expand testing across the country, to deploy supplies to our incredible healthcare workers that have done such an amazing job in the midst of the coronavirus epidemic. But my last word on behalf of the President, on behalf of our entire task force, is it's 30 days to slow the spread. And I know we're almost at the halfway point, and I know it's been a month of these mitigation strategies, but I hope as you look on, as you see the progress that's made on the West Coast, the beginnings of real progress in the greater New York City area, Louisiana, Detroit, and elsewhere, I hope it will only steel your resolve to continue to do your part to slow the spread, because we'll get through this, but it'll take all of us to continue to do it. So thank you to the American people for all your efforts, and we'll see you tomorrow.
of face shields. We can't get them.
The Emory team knew from Ebola a face shield is better protection than a mask alone. So they got creative.
Our biomedical engineers got right down to it, figured out how to design it. The rest of the engineering school over at Georgia Tech helped working on laser cutting the plastic, 3D printing the frames.
By March 1st, Dr. Lewin felt his hospital was ready for battle. So on March 6th, when the first COVID-19 patient arrived, Emory was ready, he says. Since then, the hospital says it's treated over 600 COVID patients. Dr. Colleen Kraft is one of the courageous doctors who battled Ebola here at Emory.
It's been a really packed day.
And is now fighting COVID. Her first COVID patient was the hospital's first patient.
I wanted to walk away. I had like an Ebola PTSD moment, for sure.
But of course, she didn't. Her hospital was ready, she was ready, and thankfully, the patient recovered.
The scale of this is so different than Ebola. I mean, Ebola containment worked, right? You just had to keep it in one place and never let it out. This has community transmission. We can't link all the cases to where they started. And so if that is the case, then that makes everything suspect and everything we touch suspect.
And yet, so far, the lessons from the deadly Ebola outbreak have served them well, helping them work ahead of the tidal wave, providing precious hope and expertise on the front lines.
Today, Governor Kemp said the peak for most hospital patients is now projected for April 26th. Emory says it helps him to see what happened in places like Italy, Washington State, and New York to be able to prepare. Well, you might want to check your bank account. Stimulus checks are rolling out, but if you didn't file your taxes using direct deposit, it might be a while before you get it. When you can expect that check, coming up.
Live. We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
Storms that swept through the South overnight are being blamed for at least 8 deaths in Georgia, injuring about 50 others. We saw very strong winds ripping up trees. In East Point, a massive tree fell onto 3 cars. This is Kentucky Court off of Ben Hill Road. You can barely see the underneath area of the leaves. A tornado likely to blame here. One of the hardest hit places, Murray County in northwest Georgia. At least 7 people killed when the storm tossed mobile homes. Today, Governor Kemp went to Murray to see the destruction and to address where the help is most urgently needed.
I can tell you it is devastating. It looked like a bomb went off in 2 different neighborhoods I visited. And many of those Georgians are already suffering from being out of work due to the COVID-19 virus. And now they have literally lost everything that they owned.
Declared a state of emergency to help move resources as fast as possible. Metro Atlanta, for the most part, was largely spared. I mean, there was some damage of trees being knocked down and all, but nothing very serious from what we have seen in Murray County and places like that. But Deborah Tuff spoke to a grandfather in southeast Atlanta who was in his bed, in his home, when he heard a thud, and he is very, very lucky today that he was not any closer to that tree. She has his story.
I heard the thunder and the lightning, and then I heard something hit the house.
That big bump, a big tree in Mr. Benny Brown's front yard. The 80-year-old who celebrates a birthday next month was watching storm coverage in his southeast Atlanta bedroom. He didn't think that storm would knock on his front door. We interviewed him by phone.
I thought it was. I thought it was a limb fell on the house. I didn't realize it was a tree. So my next door neighbor called me and told me to look out front.
Car crushed, limbs everywhere, shingles probably damaged Mr. Benny's grandson, among a steady stream of folks coming by to make sure he's okay.
It's not a large home. He could have easily been impacted way more than he was, and that's what I was saying. That's the biggest blessing. The fact that, the entire front yard is gone.
His water runs, his electricity is on, but there's this one nagging problem. The large tree that's crushed his car. Mr. Benny says he called the insurance company, but says they won't be coming out to get the tree or fix the damage anytime soon.
When I talked to the insurance company this morning, due to the crosses, everything slowed down, and they said they would get back in touch with me, and that's it. I haven't heard from them. I travel from Jonesboro, so I've seen a lot of different trees on the ground. I think if they were able to actually see it, put eyes on it, I think that they will be able to see, how severe it is, and maybe they'll, kind of, put a rush on, coming out.
Well, we had 851 severe weather reports across the southeast yesterday, 71 tornadoes, and 2 of those in northwest Georgia really wreaked havoc, as you've been hearing, of course. And the latest surveys coming in from the National Weather Service does rate the Bartow County tornado as an EF1. So it had wind speeds of around 85 to 90 miles per hour. They're still trying to figure out just how long that tornado was on the ground, so how long that track was in Bartow County. And then the Murray County tornado that was so deadly was an EF2, and it had wind speeds of 111 to 135 miles per hour that came roaring into that mobile home community there in Murray County. So these surveys are still ongoing. We'll find out more information about just how damaging these tornadoes were in the next few days. And coming up in Maine Weather, we'll talk about the weather you can expect in the days to come as well.
Sam, thank you. The coronavirus is still making its way throughout the state of Georgia. In total, there are more than 13,000 cases. The state health department reports 1,600 are in Fulton County alone. So far, the virus has claimed the lives of 480 people. Emory is taking big steps forward in the fight against COVID-19. This morning, the hospital announced it created a test that can identify antibodies in people who have had the virus. Our Kristi Diaz has the latest.
This is a big deal because antibodies are part of the way our body fights off a virus. And if scientists and doctors can figure out which ones protect against this virus, it could be the key to finding a treatment. I was briefed by Dr. Anish Mehta in a Zoom call this morning.
It's a real landmark achievement
He says it's a simple blood test. All it takes is one vial of blood to find out if someone has had the virus, no matter how severe or mild their symptoms. This alone will be helpful in figuring out how widespread this virus really is. Once they send the blood to the lab, Emory says they'll be able to get results within 24 hours. Right now, it's only available to Emory patients, healthcare workers, and employees, but they plan to offer it to the public down the road.
As we move forward, our Emory Medical Labs is really looking to scale up this test and hopes to reach a goal of being able to do 5,000 tests per day, hopefully by mid-June.
So what happens next? If they find out you have antibodies that protect against COVID-19, Dr. Mehta says they might invite those people back to collect more blood, to gather antibodies and plasma, and use it as a potential therapy for people who are still sick.
This test, I think, is going to be vitally important, not only to identifying people who've become infected, but also as we offer it to a broader audience, be able to really detect the impact COVID-19 has had in communities.
There's no specific timeline on when this will be available to the public, but Dr. Mehta says they're working on ways people could potentially do this test at home. They hope to have an update on that in the coming weeks.
Many in the sports industry have been trying to figure out how they can contribute to help in the coronavirus outbreak. Alex Glaze tells us about one local Atlanta sports announcer, radio host, who is stepping up and has been doing that for quite a while.
Mark Zinno is a radio host at Atlanta Sports X. He has his own radio show, A to Z with Mark Zinno. And if you're a fan of his show, you probably haven't heard from him in a while because he's been busy serving us in a different way through the Georgia National Guard.
When they say this is like a war, it is. Everybody has an important role when it comes to this fight.
Zinno's role is Lieutenant Colonel. He was called to serve as a logistical planner to help state agencies stop the spread and help people recover.
There are people who are on the front lines and doing the medical stuff, and then there are people in the Georgia Guard who are doing the decontamination, and that's a whole different role. My role is from a planning function, and I've always said, not one role is more important than the other. They all come together to make the piece of the pie that gets us to the 100% solution that we're looking for. This is a fight that literally everybody is in, right? Like, it's one of the rare instances in American history where we are in a war, but everybody takes part in it.
So how hard was it for Zinno to walk away from his radio show duties to fight COVID-19?
In this line of work, people actually like me and respect me. On my radio show, nobody in this market likes me and respects me.
But seriously, the transition was an easy one for Zinno. He's been serving in the military for decades.
I've been doing this for a long time, so I understand that when the bell rings and they need me to be somewhere, that I go. And I put my military uniform on and I put my hat on and just go to work.
Ahead tonight, forecasting is a big part of the COVID-19 pandemic. Up next, the technology that could help you figure out when you need to stay home and when you need to call your doctor.
Sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
On this Monday, here are 3 stories that you may have missed. Let's get you updated right now. Here we go. Check your bank account. Americans are starting to receive their coronavirus stimulus check payments via direct deposit. The first payments went out on Friday. The checks are part of a $2 trillion bill to stimulate the economy. For those who do not have direct deposit information registered with the IRS, it could take months for checks to arrive in the mail. Senator Bernie Sanders officially endorsed the former Vice President Joe Biden for president. The announcement came during a live-streamed conversation on the economy. Senator Sanders suspended his campaign last week, effectively making Mr. Biden the Democratic nominee to take on President Trump come November. Last week, the Georgia Secretary of State, Brad Raffensperger, once again moved Georgia's presidential primary back to for the second time this year because of COVID-19. Now, the primary is now set for the month of June. June 9th is when it is scheduled. We'll see if that happens. Primaries for the U.S. House members, 1 U.S. Senate seat, and multiple state seats are also set for June 9th.
To the current health emergency, members of the public are reminded to keep a safe distance.
Police in Savannah are using drones to enforce social distancing. The drones are being used to warn people who are too close together to separate. Police officers say the drones allow them to cover more ground since they can fly up to 100 feet in the air. A tool designed to help you figure out when to stay home and when to call your doctor could also help hospitals understand and figure out when that wave of patients may be coming their way. Reveal investigator Rebecca Lindstrom takes a closer look at the technology and who is using it.
I'm an emergency medicine physician.
Dr. David Wright is also one of the physicians that helped create C19check.com, a tool that you can use on your phone or computer when you're not feeling well to help figure out what to do about it.
It's an educational tool. It is not a diagnostic. It will not tell you whether you have COVID or not.
Using information based on your symptoms and medical history, it will tell you if you should self-isolate, call your doctor, or...
Third case is what we call the high-risk case, which is where it'll say call 911 or go to your local emergency department.
That's just what the triage tool has told about 48,000 people to do since it launched 3 weeks ago. More than 500,000 people from around the world have visited the site, about half actually completing the online survey.
Pakistan is one of the higher users outside the United States. Pakistan and India, and we have it in multiple languages.
Wright says the tool isn't meant to replace your doctor, but it could help them prepare. The programs don't collect your personal information, but if you agree, they will track symptoms by zip code.
We know there's a lag in time between when someone gets infected and when they need intensive care. So if I go on the app and record symptoms, and so does one of my neighbors, along with several other people in the same zip code, the CDC could get a heads up that would help hospitals prepare for the next hot spot.
I'm careful to compare this to wartime because I respect the military so much and what they do. These viruses are like the bullets. And if we're not careful, it could kill us too.
So far, nearly 40% of the people using C19check.com are what Wright describes as the worried well, those that are sick, but not with symptoms related to COVID-19. It is crucial, he says, that their curiosity or concern doesn't trigger a visit to the hospital, where they could end up exposed to the virus.
For many people, it's scary. This is an enemy that we can't see.
C19 Check is creating an option for those at elevated risk to get a text message reminder to take the test again. The CDC did work with Apple to create its own online tool, but both denied our request for information.
Your 11Alive storm trackers worked through the night, keeping you informed about that line of severe storms and the swarms of tornadoes that we saw moving across north and middle Georgia during the dark overnight hours. So we had over 850 reports of severe weather across the southeast as that line made its way across on Easter Sunday. So damage like this coming in from our storm tracker team, our 11Alive storm tracker Sandy Scott Krause in Toccoa, saying that this debris fell on top of her car and her truck. She fears they are both totaled there in Toccoa. And Robert Slattery, one of our newer 11Alive storm trackers, showing us views of the rock and just how some of these trees totally uprooted, ripped out of the ground, and then many of them also just snapped off. So we are going to be cleaning up from this severe weather outbreak for a long, long time, and it's going to be scarring the countryside up there for many moons as well. Looking outside, you can see the moon tonight in between the clouds. City of Noonan looking at a very pleasant evening out there. The winds are dying down, and the temperatures are very comfortable for that last walk of the evening. So we're looking at 67 in Atlanta right now, 69 in Peachtree City, 73 in Thomaston, 55 in Clayton, and 55 in Blairsville, where temperatures will be getting down into the 40s tonight. So, in fact, everyone will be down in the 40s. They'll be in the low 40s, though, in the mountains of North Georgia. So we're expecting to see temperatures in Atlanta get down into the mid to upper 40s overnight. We will see plenty of clear sky peeking in through a couple of clouds. So I think we'll clear it out overnight. We've had those clouds that have been wrapping around the low today behind that huge system, but they should be scooting on out as the low moves off to our northeast. So we'll see those skies continue to clear overnight tonight, and then hour by hour tomorrow, plenty of sunshine. Notice how those temperatures are going to be in the upper 60s for much of the afternoon. We'll likely make it just into the low 70s as we get into the warmest parts of the day, right around 4 or 5 o'clock in the evening, and no rain in the next few days. So we're looking at a beautiful pattern as we head into the middle of the week. So cool mornings, unseasonably cool. We'll see nice mild afternoons, pretty close to average or just a degree or two below. So a very nice quiet week to clean up after that horrendous outbreak last night that moved across during the overnight hours. So we'll see a mixture of sunshine and clouds this week. And on our wazometer on our Tuesday, that makes it a 10. Not quite an 11 because we will see a few clouds, and temperatures are going to be on the cool side to start in the morning. But other than that, it's going to be a pretty perfect day. So we'll see more of such days this week as temperatures will be a little cooler as we head into Wednesday, but still a nice pattern. Possibly a few clouds. You may remember we had rain in the forecast yesterday. We've taken that out. We just don't think there's going to be enough moisture to actually get rainfall on Wednesday. Another dry day on Thursday and Friday. And then over the weekend, those rain chances creeping up. But right now it looks like spring showers this time around. Keep fingers crossed. No thunderstorms this time. We will certainly be watching out for that, though.
All right, a woman in Charlotte has not left her house in more than 3 weeks, and still she tested positive for COVID-19. It is staggering. Rachel Brummert says because she has an autoimmune disease, she listened to the advice of experts early on. She took one trip to the pharmacy weeks ago and has only been in contact with just a few people. Her husband is living in a different room of the house. She's received a couple of packages. There was also a person who delivered groceries to her doorstep, and she says that person later tested positive. Wow, we'll have that story coming up straight ahead.
Coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority.
All right, this is an unsettling story, particularly for all of us who have stayed in our house, in our home, in a room like I am in right now for weeks without really leaving. You know, we want to stay clear of COVID-19, but maybe that's not possible. Check out this story from a woman in Charlotte. It is unsettling and troubling, and it may be the one story that you take from this newscast that you will be thinking about overnight. Her name is Rachel Brummert, and she has been living in her house and really sequestered from everybody. She went to the pharmacy a couple of weeks ago, but she has only been in contact with a few people. Her husband, as I mentioned earlier, living in a different part of the house. She's had a couple of packages. Somebody delivered groceries to her door, and she later discovered that delivery guy tested positive for coronavirus.
and I barely had any contact. I mean, I didn't even touch her. From what I'm hearing about ventilators, it's scary stuff. I really hope that I could just wait this out at home.
Experts say that people with coronavirus are very contagious, even before they start showing symptoms. But this woman's story shows how hard it can be to trace back the line of infection. Even now, she's not 100% sure where she got it from. Still ahead at 9, Mcgovern describes the damage like a bomb went off as storms rip apart homes in Georgia, killing at least 8 people. In the destruction, a story of survival. Hear from the man buried under a lot of metal for nearly an hour before he was finally pulled to safety.
Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear, on 11Alive News Primetime.
As families are stuck indoors, experts are warning about the amount of time children are spending on their phones and watching television. But all screen time isn't necessarily bad. Eric Alvarez shows us how technology can be beneficial during this unusual time.
The American Academy of Pediatrics says with schools, parks, libraries, and businesses closed, and families being told to stay in their homes because of coronavirus concerns, the amount of time kids are going to spend in front of the TV or on a smartphone or other device is likely going to go up. And that's okay. But it's also important to keep track of it all. That's right. And to set limits. The Academy says the average kid gets about 7 hours of screen time in a normal day. But that's starting to go up because these are anything but normal times.
Because screen time is a necessity.
Lauren Stockard of Fort Worth Mom says it's okay to adjust screen time rules because right now, time on a device isn't always spent playing games or watching movies.
Everyone's doing online learning and we're using technology to keep in touch with our family and friends.
Stockard says instead of binging shows, find videos that encourage kids to be active.
We watch shows like Go Noodle, which encourages doing jumping jacks or silly dancing moves.
It's also important to set a plan and stick to it.
We kind of section out our days.
The American Academy of Pediatrics has a screen time calculator on its website and lets you set times and places kids can and cannot use their devices, which Stockard says could bring a sense of structure in an uncertain time.
Things aren't normal. This is not normal. And so we kind of need to do what we need to do to get by.
11Alive News Primetime on the ATL starts now.
Right now at 9, devastating destruction, at least 8 people killed as a series of violent storms rip
across Georgia. Plus, new emerging COVID-19 hotspots in our state. You might be surprised by where they are popping up. One local leader gives us his take. Hello, everyone. I'm Ron Jones reporting from home tonight.
And I'm Aisha Howard here at the 11Alive studios tonight. We began our team coverage in Maury County. At least 7 people died, another 23 hospitalized after storms hit Chatsworth in northwest Georgia mountains. 11Alive's Doug Richards was there as Governor Kemp saw the damage firsthand today.
Authorities and residents here in Maury County say that at least one and perhaps more tornadoes struck here overnight. The storm near the Tennessee line seemed to find communities dominated by mobile homes. Residents told us the storms picked some of them up, moved some of them from one piece of property to another, and obliterated many of them.
It's still standing.
Miguel Castillo described being inside one of them as the storm struck.
And the house, it feels like I just flipped. I had the baby in my arms, and then the 5-year-old was like right behind me. And when we came to, it was just, I looked and the baby was right there in my arms, like scared. And then my little niece her hair was pinned down on something. And I was able to get her out.
House on that side of the road is now on this side of the road. It was really bad, a lot of loss of life.
Around midday, Governor Brian Kemp and other state officials visited the area. Kemp says the state has gotten reports of destruction from here in northwest Georgia all the way to Liberty County near Savannah. Residents and officials say the coronavirus pandemic will only add to the challenge of making a healthy recovery from the destruction of last night's storms. By early afternoon, the death toll here in Maury County had risen to 7. Residents and Governor Kemp both say it is remarkable that it's not higher.
Chief Meteorologist Chris Holcomb was in the 11Alive Storm Tracker Center in the early morning hours. I asked if he was rested. The answer was no. Working so hard to keep our family safe. He is back there tonight. Hi, Chris.
Hey, you know, we're fine. We're fine. We knew that it was going to be a long day and a long night last night, so we'll get that rest. We'll catch up on that. I know I was just talking to folks on Facebook Live. You can see my phone right here. We have over 500 people on Facebook Live right now, and I was just saying to them, I'm not the only one that didn't get sleep. A lot of folks didn't get sleep last night because it was so hard to sleep with the anxiety of just knowing that these storms were rolling through, and then when they did come through, it was almost impossible to sleep. So take a look at this. Go ahead and look at the big picture. These markers that you're seeing here right now on radar, all of that you're seeing indicates where we had storm damage, whether it was wind damage or damage from hail or even tornadoes. When some of the tornado warnings were issued last night, they were already observed and confirmed, but now the National Weather Service is going out to look at other storm reports as well to not only get a confirmation of a tornado, but also to determine how strong it was. So take a look at this now on the big screen. Let me show you. We're watching all of those markers that you see here in the southeast. That is where we had reports even in the southeast of damage from tornadoes or even from wind or hail. All that moisture is down to the south now, and it is gone. Here's a look at some of the reports that we have from some of the surveys from the National Weather Service. This is still a preliminary. It's not a final report, but they did tell us for their survey of the Bartow County tornado up near Cartersville that it was rated as an EF1 with the wind speed of about 85 to 90 miles an hour. We don't have the path length on that yet. And then in Maury County, they're saying it was an EF2. They didn't give us specific winds, but an EF2 is between 111 and 135 miles an hour, and they said it was a high-end EF2. We'll have that final report. We'll kind of narrow down that path length and the exact location. Stay with us. We'll talk more about what to expect for the rest of the week and if we have any additional storm risks coming up. Stay with us.
This is one of the homes destroyed. The husband and wife who live here tell me they held onto each other in a hallway while the wind broke apart their home all around them. Upson County residents woke up to these sirens alerting them of a potentially deadly tornado on its way. When daylight broke, thousands of trees snapped in half. More than 50 structures damaged, 6 homes destroyed. The county's emergency management agency director says no one hurt.
It could have been a whole lot worse than what it is. It's bad, but it could have been a whole lot worse than it is.
The wind so strong, it picked up this entire house, dropping it in the middle of Highway 74. To give you some perspective of how far the home went, this is its former foundation, and this is where it ended up, right in the middle of that road, before bulldozers moved it to the side.
This is a blessed community, very blessed, always has been. and continues to be. It's just amazing that we haven't had any injuries.
County emergency management officials conducted a damage assessment by helicopter earlier today. They suspect at least a 16 to 18 mile path of destruction. The National Weather Service will make the final determination, but officials here believe it was at least an F3 tornado.
The whole place started shaking. I dove headfirst in the bathroom, and next thing I know, I got the world on top of me.
South of Atlanta, the storm left a Monroe County man buried under farm equipment and debris. He was trapped for nearly an hour because resources weren't able to finally pull him out. He told 11Alive's Tracy Amick-Peer he couldn't believe his life was spared.
This huge pile of metal debris was a barn home just late last night. Now the sides and the roof are wrapped around trees behind me. Take a look here. You can see this brown metal throughout. It's actually the beams that held this huge structure up. These beams are made out of iron and are so heavy it's hard for machinery to even move them. Taking a look at all this, it's hard to believe anyone made it out alive. Chris Burkett was home overnight when it hit. He says it lasted only 10 seconds, but in that time, everything in this barn home was destroyed. There were airplanes, hot rods, farm equipment, even a pontoon boat. Burkett says it still came as a surprise. He was pinned down under the debris but could move his right arm to call 911.
I just got hit by a tornado and I buried in my barn. I'm buried. I need help bad.
It took 45 minutes for Monroe County's Sheriff's Office, EMS, and Fire and Rescue to get him out because they had to cut down trees on the road to reach him. Then, 10 hours later, they found his dog Kaya and were shocked that she was fine. Now they're just picking up the pieces.
It'll get bought again. Nobody's dead. My dogs are alive. It's a good day.
I talked to Monroe County's Public Safety Director, Brian Meadows, and he says it could take the National Weather Service up to 10 days to come down here and verify if this even was a tornado, and if it was, at what level. That's because they have so much damage elsewhere they need to verify.
I'm Jennifer Bellamy in the newsroom. Our 11Alive community storm trackers are a huge part of our coverage anytime we deal with severe weather. Some of you started sharing images with us about how you were getting ready for the storms, and others posted damage they experienced overnight. It all shows just how wide-reaching last night's storms were all over the state. Lightning and fierce winds overnight in Lula, Georgia, seen in this video shared by Nicole Prisa. A view similar to the one from Mandolin in the Dallas-Ackworth area. But daylight brought a clearer view of the storm's impact across the state. Here's a look at Toccoa. Amber Gilbert shared these photos of a huge tree that came down in her yard. Another picture showed a mass of branches down over parts of the roof and cars. Out in College Park, Victoria Snyder Hernandez shared damage to her yard as well. A tree at least 40 feet was just one of a few to fall, bringing down part of a fence and leaving debris throughout the property. And the Dalton Fire Department using some compelling images to drive home a message of safety. Turn around, don't drown. Fortunately, firefighters were able to safely rescue a driver from this car around 7 this morning off Willowdale Road near Highway 41. They warned against drivers ever trying to maneuver around barricades to get through floodwaters. And remember, we would love for you to be a part of our community storm trackers as well. Just search 11Alive Storm Trackers on Facebook and request to join the group.
Officials say the EF1 tornado that touched down in Bartow County overnight killed a Cartersville man. The coroner is confirming with 11Alive that 34-year-old William Gregory McConnell died when a tree fell on his home while he was still sleeping. Meanwhile, the Bartow County Fire Department is now investigating as to why the sirens never went off as the storm was fast approaching. So they took to Facebook to talk about it. They're working with the Sheriff's Department. This is what they're posting. Working with the Sheriff's Department to figure out why tornado sirens did not go off last night, despite having protocols in place for both the county and Cartersville. They also point out people inside buildings may not have heard the sirens and encourage everyone to sign up for alerts on their phones. And in southeast Atlanta, an elderly man was in his home and he hears this huge thud, and it was actually a tree that crashed into his front yard just feet from his bedroom. We spoke with him on the phone.
I thought it was a limb fell on the house. I didn't realize it was a tree. So my next door neighbor called me and told me to look out front.
80-year-old Benny Brown lives in this Lakewood community home with his housekeeper. She uses his car to grocery shop for him. Well, that car was completely crushed by the tree. Brown admits it could have been a whole lot worse, but says it is a blessing that he was not hurt. With insurance companies bogged down with claims, he says he's not sure when he's going to get that tree off of his car.
For who is tested today, Governor Kemp announced those are priorities as we continue moving forward through this pandemic. Our John Sherrick has more on what the governor says must happen before he reopens the state.
Governor Kemp said he can't even think about lifting stay-at-home restrictions and other restrictions. Not yet. Not until he says Georgia begins to see the numbers of infections and deaths decrease. He has three priorities of equal importance. He's trying to expand hospital capacity across the state in order to meet the April 26th peak of cases. April 26th, not April 20th, as earlier projected. He's trying to stop the alarming surge of infections and deaths in nursing homes and other long-term care facilities. And he announced new orders to increase testing by expanding who is eligible to receive the tests.
Despite our partnerships and undeniable progress, our testing numbers in Georgia continue to lag. As I've said before, the status quo is unacceptable, and Dr. Toomey is pushing public health officials across our state to collect more specimens and to process more tests. It's just time to hunker down, make sure we can get to the peak, flatten things out, and then start going the other way. And then those are the things that we're going to have to really start answering and be very nimble, I think, at dealing with.
And Governor Kemp said he wants to make it crystal clear people are still going to have to get authorization before they can get tests. They have to go, for example, to a doctor or to the county health department to get authorization to receive the tests.
At this hour, there are more than 13,000 confirmed cases of coronavirus in Georgia, and 480 people have lost their lives to this disease. But there are also signs the rate of infection is slowing down, even with the expected peak of the virus still days away. Each day, we're learning more about how the coronavirus is spreading. The state health department is now identifying several hotspots based on county population. The majority are rural counties in southwest Georgia. Joe Henke gives us a closer look.
In new data released by the Georgia Department of Public Health, these 20 highlighted counties have the highest rates of confirmed COVID-19 cases based on the size of their populations. All of these counties have 200 to around 1,700 cases per 100,000 people. This includes Dougherty, Early, Randolph, and Terrell counties, with rates of more than 1,000 cases per 100,000 people. Compare this to Fulton County, where there are nearly 1,600 confirmed cases, the most in the state for a single county, but based on population, there are only 147 cases per 100,000 people. The 20 counties with the highest rates of confirmed COVID-19 cases also account for more than 1/3 of the state's deaths from the virus. 77 of these deaths are from Dougherty County alone. State Representative Gerald Green represents several of the highlighted counties.
The nursing homes are being really hit. The area of Albany, where I represent, down there with that hospital, they have worked tirelessly. I've never seen more courageous people who show up for work.
Green says for weeks, cases continued to increase, and he would hear of people still attending funerals in his area while not limiting the amount of people attending or not practicing social distancing. He says now he is seeing less people in public and more of them are wearing masks.
Tragedy of all this is finally making people realize that it could happen to me.
So as the number of COVID-19 cases continue to grow, so are the number of people actually being scammed every single day. And the federal agents, they're taking notice and taking action.
As the federal government tries to slow the spread of coronavirus, they also want to stop COVID-19 scammers.
It's just a get-rich-quick scheme.
Homeland Security is now teaming up with Georgia's top state and federal prosecutors to crack down on these criminals.
Anytime you're looking at giving your money to somebody, you need to really be looking at, are there red flags?
Some schemes include fake cures and medicines that could do more harm than good. Special Agent Robert Hammer gives us one example of a fake vaccine.
However, it was nothing more than cotton infused with insecticide.
And even fake test kits. They're also claiming to have high-demand products like cleaning and medical supplies. But when you place an order, they take your money and run.
Portraying that they have millions of N95 masks, when in fact they don't even have those masks.
Charity scammers are asking for donations for fake nonprofits to help people affected by coronavirus and COVID-19 related apps that actually contain malware to steal your personal information. If you think you've been scammed, send your tips directly to the feds.
And we have a full team of agents that are dedicated to doing nothing but triaging that information as it comes in.
So for more information on how you can actually report those criminals, we have a link directly to those federal investigators on our website at 11alive.com.
Emory is helping lead the fight against COVID-19. Coming up, exclusive details on a clinical trial that could be the key to finding a treatment.
Lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
I'm meteorologist Chris Holcomb from the 11Alive Storm Trackers. You are looking live now at our radar, which is showing the markers where we have reports of damage here last night. And all of those are indicating either wind damage or hail observed or even tornadoes. And as some of the tornado warnings last night were issued, they were already confirmed as tornadoes. But now the National Weather Service is going out and surveying that damage to confirm it was a tornado, as well as to determine how strong they were. And remember, as we were building up to this storm, talking about it a few days in advance, talking about it would be a significant severe weather event over the southeast, this is where we had a lot of damage all over the southeast. So that storm system is now gone. It has pushed out. Down to the south is where we still have some rain, but now we have some nice weather left behind. We talked earlier about this Murray County tornado that was rated as an EF2. We don't have the final report in yet. We don't know the path length, and we have a wide range of wind speeds here. An EF2 is anywhere between 111 and 135 miles an hour. So far, the Weather Service is saying this is a high-end EF2 for that storm up in northwest Georgia. So let's take a look at the temperatures around North Georgia. Thank goodness. You know, I'm talking with my folks on Facebook Live, and that Facebook Live is still going on right now. And a lot of people were talking about how, number one, they're glad the weather was calmer today, and number two, a lot of people are anxious to get some good sleep tonight because we do not have any bad weather tonight to interrupt our sleep. And temperatures are cooling down. We're 64 in Atlanta. Look at these 50s up in North Georgia. We're going to see those 50s moving in here really soon, and then even moving down into the 40s here by tomorrow morning. Look at these lows in the mid-40s. So it's going to be kind of chilly to start. We will see a good bit of sunshine, though, during the day. Dry weather conditions starting off here in town. I'm thinking it'll be 48 degrees, and then highs in the afternoon up to 72. We're going to go with a 10 on the wasometer here for your Tuesday, with sunshine just mixing in with a few clouds. In fact, you'll see what we have going on here. Not a lot of weather features showing up. And I think a lot of people are happy about that because we'll see that mix of sun and clouds during the day tomorrow, no rain, and it really looks like most of the week is going to be rain-free. Earlier we had a low rain chance in on Wednesday, but we're taking that out now. We really don't think that moisture is going to develop here on Wednesday. And for most of the work week, we're going to stay dry as well. Once we get into the weekend, the models are not in total agreement. We're going with the low rain chance here on Saturday at about 20% and then a 30% chance on Sunday. Based on some of these model updates, we might have to bring those percentages up a little bit. So you can see here tomorrow, good day, a 10 on the wasometer, a mix of sun and clouds, highs near 72. Then on Wednesday, we'll see partly cloudy skies in our area with a high of 66, a little cooler. Look at these cool mornings, 43 on Thursday. And then 48 on Friday with highs in the 70s. And low rain chances Saturday. We may be bumping up those rain chances for Sunday and Monday with high temperatures that'll be in the 70s.
While researchers around the world focus on finding a vaccine, teams at Emory University Hospital are working to develop treatments to help those already sick. Tonight, encouraging news about a drug that may be the most promising. Tom Costello has an exclusive look.
On the ICU floor at Emory University Hospital in Atlanta, a drug trial for a potential lifesaver.
This is remdesivir versus placebo for one of our patients.
Doctors prescribing remdesivir delivered in IV form to patients sick with COVID-19. The Emory trial is one of the largest in the world. Infectious disease expert Dr. Anish Mehta is the chief investigator.
What we're searching for are medications that will help people get over the infection more rapidly and allow their immune systems to really kick in and knock the virus out of their body.
Remdesivir was originally tested to treat Ebola patients, but early results suggest it could be far more effective in treating COVID-19. It's a double-blind NIH study, meaning patients and doctors don't know who gets a placebo.
What we have seen is lots of patients recovering. Whether that's because they're getting a study drug or a placebo, we don't know.
In Washington state, ICU doctors did give remdesivir to Chris Kane as he struggled to breathe.
I mean, within 48 hours, I was feeling a lot better.
We're just so thankful, and then to get him on this drug so quickly was just an absolute godsend.
Now, researchers could be just 2 to 3 weeks away from a major breakthrough, determining whether remdesivir should be the go-to treatment in hospitals. Meanwhile, doctors are increasingly cautious about an unproven treatment touted by President Trump, hydroxychloroquine combined with an antibiotic. Researchers in Brazil canceled a small chloroquine study after some patients developed cardiac arrhythmias and even died. But back at Emory, some COVID patients are insisting on getting what they heard President Trump talk up.
And they say, I don't want an experimental drug. I want the drug on the news.
If approved, drug maker Gilead says it could have enough remdesivir to treat 140,000 people immediately and 500,000 by October.
Coming up in the next half hour, we're taking a deeper look at antibody testing and how it could help people get back to work.
Also straight ahead, we're going to introduce you to a group of people determined to shine some light to get us through these dark, uncertain days.
Changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime.
Uncertainty. We hear that a lot. It's a common theme as we deal with this pandemic, not just across the United States, but obviously right here in our state. And three friends are coming together now to try to stop that negativity with some positivity. 11Alive's Matt Pearl has their story.
Juliana, Sophia, and Leo are on a mission.
My friend actually messaged me one day asking how my mental health was doing because I didn't even realize that I was posting so many negative news online. So then I started to actively look for positive news online that talk about vaccine, treatment, and recovery stories. And then I realized there's actually quite a lot of stories out there.
So the three friends began building a new site, sharing all the good coming from this trying and tragic situation.
It's actually something that I look forward to doing every morning when I wake up. It's just a really good way to start the day.
The idea that we can really get some positive news and give them hope in a really challenging time, I think, yes, it's definitely made us feel better mentally for ourselves.
From making sense of science to sharing Spotify playlists, they're gaining fans around the world.
It's been amazing, simply amazing. We received not only we received so many positive feedbacks from not only our friends but also from strangers.
This is definitely the first big kind of pandemic or outbreak that we've seen such a huge response to.
I just want everyone to know that everyone is working hard to fight this together.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
storms that swept through the South overnight are now being blamed for at least 8 deaths in Georgia, injuring about 50 others. We saw very strong winds just ripping up trees. In East Point, a massive tree fell onto 3 cars. This is on Kentucky Court, right off of Ben Hill Road. You can barely see them underneath the leaves. A tornado likely to blame here. One of the hardest hit places, Maury County in northwest Georgia. At least 70 people were killed when the storm tossed mobile homes. Today, Governor Brian Kemp went to Maury to see the destruction and assess where help is most needed.
I can tell you it is devastating. It looked like a bomb went off in 2 different neighborhoods I visited. And many of those Georgians are already suffering from being out of work due to the COVID-19 virus. And now they have literally lost everything that they owned.
The governor has now declared a state of emergency to help move resources as fast as possible. You know, Metro Atlanta was largely spared the extensive damage out there. But Deborah Tuff actually spoke with a grandfather today who says that he is lucky to be alive after a tree just fell just feet from his bedroom.
I heard the thunder and the lightning, and then I heard something hit the house.
That big bump, a big tree in Mr. Biddy Brown's front yard. The 80-year-old who celebrates a birthday next month was watching storm coverage in his southeast Atlanta bedroom. He didn't think that storm would knock on his front door. We interviewed him by phone.
I thought it was. I thought it was a limb fell on the house. I didn't realize it was a tree. So my next door neighbor called me and told me to look out front.
Car crushed, limbs everywhere, shingles probably damaged Mr. Benny's grandson, among a steady stream of folks coming by to make sure he's okay.
It's not a large home. You know, he could have easily been impacted way more than he was, and that's what I was saying. That's the biggest blessing. The fact that, you know, the entire front yard is gone.
His water runs, his electricity is on, but there's this one nagging problem. The large tree that's crushed his car. Mr. Benny says he called the insurance company, but says they won't be coming out to get the tree or fix the damage anytime soon.
When I talked to the insurance company this morning, you know, due to the crisis, everything slowed down, and they said they would get back in touch with me, and that's it. I haven't heard from them.
I travel from Jonesboro, so I've seen a lot of different trees on the ground. I think if they were able to actually see it, put eyes on it, I think that they will be able to see, you know, how severe it is, and maybe they'll, you know, kind of, you know, put a rush on, you know, coming out.
And April is one of the months that we have usually an active time for severe weather. And March, April, and May are the months most likely for us to have severe storms and tornadoes. And a lot of times it's because it's in that change of seasons where we're moving from wintertime to springtime and then eventually summertime. And as you see those air masses change from being cold to then to warm air come in, a lot of times we'll see some volatility there along that air mass, like with a cold front coming in. So right now, that warmer air is down to the south, and we're going to see some cooler air that's going to move our way now that that system has pushed away, and we're going to have that northwest flow bringing in some of that cooler air. The next few mornings, it's going to be kind of chilly with temperatures in the 40s, but then afternoons are going to be pretty comfortable. Once we get in toward the end of the week, still, you know, close to average or maybe a little cool, and then by the weekend, these temperatures start warming up a little bit more as we see another warm air mass move in before it cools off again into next week. And with that change of that air mass, we might see our rain chances coming up a little bit for the weekend. At this point, doesn't look like storms though. Stay with us. We're going to talk more about that in your 7-day outlook.
The coronavirus is still making its way throughout the state of Georgia. In total, there are more than 13,000 cases. The state health department reports 1,600 are in Fulton County alone. So far, the virus has claimed the lives of 480 people. Most experts agree that moving safely beyond this pandemic will depend on testing and tracking. And tonight, there are new developments on both fronts, including a new effort by Apple and Google. Here's Gady Schwartz.
With much of America shut down, tonight the promise of progress. New COVID-19 blood test called antibody tests could help get some Americans back to work. Dr. Margaret Zhang just took one in New York.
Having antibodies and knowing that I'm as immune as one could be to COVID right now makes me feel even more kind of inclined to serve.
UCLA began using its own version of antibody testing, focusing on thousands of medical workers.
How can we expect our health workforce to be protecting us if we're not doing everything that we can to protect them?
The concept is simple. If you've had COVID-19 and recovered, it's because of special antibodies in your immune system that have developed to fight it off, and those will likely protect you from future infection. In the case of medical workers, those with antibodies could become super soldiers in the fight against COVID-19.
I think that healthcare workers who know that they have antibodies will be able to go into to their work more confident that they're not going to be getting themselves sick or then passing this virus on to others around them.
Other tests are being given to the general public in Los Angeles as well. 64-year-old Deborah Presley had her finger pricked and blood drawn as part of a USC study. Within minutes, she learned she had antibodies to fight off coronavirus.
When you found out that you had the antibodies, what went through your mind?
I'm a caregiver, and I go to different people's homes, and it's just such a relief because now that I can help other people.
Now dozens of labs all across the country are working on their own antibody tests. Last week, the Trump administration said they are working to make antibody testing free and widely available.
Starting with the next week or so, we'll be able to scale up the kind of antibody testing to give you a good feel for what the penetrance of the infection is. But you can start think about some aspect of getting back to normal without having tested everybody in the country, that's for sure.
But the FDA commissioner also warning not every antibody test is accurate.
No test is 100% perfect, but what we don't want are wildly inaccurate tests.
Then there are the diagnostic coronavirus tests, but all told, still less than 1% of the U.S. population has been tested. Just a fraction of what experts say is needed to get a clear sense of how many people may be infected. For now, making complete contact tracing still out of reach. Something authorities say is vital for stopping the virus's spread.
You know, many in the sports industry are doing what they can as we deal with this coronavirus crisis. 11Alive's Alex Clay spoke with a local radio personality who is stepping up, and he's been doing this for quite some time.
Mark Zinno is a radio host at Atlanta Sports X. He has his own radio show, A to Z with Mark Zinno. And if you're a fan of his show, you probably haven't heard from him in a while because he's been busy serving us in a different way through the Georgia National Guard.
When they say this is like a war, it is. Everybody has an important role when it comes to this fight.
Zinno's role is Lieutenant Colonel. He was called to serve as a logistical planner to help state agencies stop the spread and help people recover.
There are people who are on the front lines and doing the medical stuff, and then there are people in the Georgia Guard who are doing the decontamination, and that's a whole different role. My role is from a planning function, and I've always said, you know, not one role is more important than the other. They all come together to make the piece of the pie that gets us to the 100% solution that we're looking for. This is a fight that literally everybody is in, right? Like, it's one of the rare instances in American history where we are in a war, but everybody takes part in it.
So how hard was it for Zinno to walk away from his radio show duties to fight COVID-19?
In this line of work, people actually like me and respect me. On my radio show, nobody in this market likes me and respects me.
But seriously, the transition was an easy one for Zinno. He's been serving in the military for decades.
I've been doing this for a long time, so I understand that when the bell rings and they need me to be somewhere, that I go. And you know, I put my military uniform on and I put my hat on and just go to work.
Forecasting is a big part of the COVID-19 pandemic. Next, technology that could help you figure out when to stay home and when to call your doctor. A beautiful message in the sky for everyone working on the front lines of coronavirus, and a little encouragement to everyone else. Planes made a heart in the sky over the weekend. People from Piedmont Hospital in Noonan and Piedmont Fayette told us they could see it. Lovely shot. Stick around. We'll be right back.
Fake. We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your
Welcome back, everyone. Here are 3 stories you may have missed today, so why don't we jump right into it. This first one may be very encouraging to you because you need to check your bank account. Americans are starting to receive their coronavirus stimulus check payments via direct deposit. The first payments went out on Friday. The checks are part of a $2 trillion bill to stimulate the economy. For those who do not have direct deposit registered with the IRS, it could take months for checks to arrive in the mail. Senator Bernie Sanders has officially endorsed Joe Biden for president. The announcement came during a live stream conversation on the economy. Sanders suspended his campaign last week, effectively making Biden the Democratic nominee to take on President Trump in November. You know, last week, Georgia's Secretary of State, he actually pushed Georgia's presidential primary back for a second time this year. So this is what we know. Because of COVID-19, of course, the primary is now set for June 9th. Primaries for the House, the U.S. House members, the U.S. Senate seat, and multiple other seats are also set back for June 9th.
To the current health emergency, members of the public are reminded to keep a safe distance.
Police in Savannah are now using drones to enforce social distancing. The drones are being used to warn people who are way too close together, telling them to separate. Police officers say the drones allow them to cover more ground since they can fly up to 100 feet in the air. Well, there's a new tool out there, some technology that can help you to decide should you stay home or should you call a doctor, and this same technology could possibly help hospitals know when they're going to get a flood of patients at their front door. 11Alive Reveal investigator Rebecca Lindstrom takes a closer look at this technology.
I'm an emergency medicine physician.
Dr. David Wright is also one of the physicians that helped create C19check.com, a tool that you can use on your phone or computer when you're not feeling well to help figure out what to do about it.
It's an educational tool. It is not a diagnostic. It will not tell you whether you have COVID or not.
Using information based on your symptoms and medical history, it will tell you if you should self-isolate, call your doctor, or...
Third case is what we call the high-risk case, which is where it'll say call 911 or go to your local emergency department.
That's just what the triage tool has told about 48,000 people to do since it launched 3 weeks ago. More than 500,000 people from around the world have visited the site, about half actually completing the online survey.
Pakistan is one of the higher users outside the United States. Pakistan, and India, and we have it in multiple languages.
Wright says the tool isn't meant to replace your doctor, but it could help them prepare. The programs don't collect your personal information, but if you agree, they will track symptoms by zip code.
We know there's a lag in time between when someone gets infected and when they need intensive care. So if I go on the app and record symptoms, and so does one of my neighbors, along with several other people in the same zip code, the CDC could get a heads up that would help hospitals prepare for the next hot spot.
I'm careful to compare this to wartime because I respect the military so much and what they do. You know, these viruses are like the bullets. And if we're not careful, it could kill us too.
So far, nearly 40% of the people using C19check.com are what Wright describes as the worried well, those that are sick, but not with symptoms related to COVID-19. It is crucial, he says, that their curiosity or concern doesn't trigger a visit to the hospital, where they could end up exposed to the virus.
For many people, it's scary. This is an enemy that we can't see.
C19 Check is creating an option for those at elevated risk to get a text message reminder to take the test again. The CDC did work with Apple to create its own online tool, but both denied our request for information.
In World War II, Americans were asked to use their skills and talents to support the war effort. Today, it's a different kind of conflict, and like their 1940s contemporaries, many stand ready to answer the call.
The whole class is about finding a problem in your local community and trying to solve it.
Maddie Anderson works at the Weber School in Sandy Springs, a fabrication lab manager in the school's Daniel Zalick Academy. She wanted to aid in the battle against COVID-19. Then she heard someone was looking for help to build intubation boxes, a key form of personal protective equipment physicians use when treating patients suffering from respiratory issues that stem from coronavirus.
We had seen the box or some diagrams on the web and had reached out to area schools.
Maddie jumped at the opportunity.
I immediately called them and got in touch with them, and they were saying, well, we need as many as you can make.
They would settle on 21 boxes. Family and friends donated money. Personal contacts within the Home Depot helped connect the group to local vendors. Maddie assembled her team and got to work.
We are able to do quite a bit of manufacturing on our own, but honestly, assembly is the longest part, and that takes the most time.
Through patience and persistence, they accomplished the mission. 21 intubation boxes that will be delivered to 10 Wellstar Healthcare System hospitals. Doctors there will provide feedback. For the team, it's a success. For Maddie, a source of relief.
My mom works in healthcare, and so hearing about, there's a lack of protective gear, and the numbers are getting higher than we expected. And so for me, it was kind of coming from a personal place of, I'm anxious, I want to help my mom.
Stepping off the sidelines to save those who sacrifice on the front lines.
If you've been outside tonight, you probably noticed those temperatures are dropping a little bit. We made it up into the 70s today for a high, but right now we're in the mid 60s, and it's even cooler up in North Georgia with more 50s up there. And this cooler air is going to keep sliding our way tonight. We'll be in those 50s really soon, and then eventually by tomorrow morning, we're even going to drop into the 40s. So it's going to be a cool start with temperatures that are going to be trending a little bit below the average. Here's a look at your forecast track. You can watch those temperatures tonight as they'll be falling in the morning. We wake up in the 40s. Even some mid 40s in North Georgia, lower 40s, 30s. How about Blairsville? Waking up at 38 degrees, and then even 50 degrees in the Eatonton area to start. And then we warm up pretty nicely during the day, up to about 63 at noontime, and then continuing to rise into the lower 70s once we get into the afternoon hours. Now, we should be around 72 degrees for our average high temperature for this time of year. Today, we were a couple of degrees higher than that at 74, and we had mild temperatures this morning at 60. Thanks to the clouds that were around and that rain that was lingering in spots before everything moved out. We should be around 51 for this time of year. And we picked up about 3/4 of an inch of rain overnight last night. Some folks got a lot more, though. It all just depends on if you got stuck under one of those heavier bands or heavier cells of storms. We had a lot of really heavy rain in northwest Georgia last night that actually caused some flash flooding and even some water rescues in spots up around the Dalton area in Whitfield County. Over the next couple of days, We're going to have cool mornings here with those temperatures that'll be dipping down into the 40s and then rebounding with some comfortable afternoons tomorrow in the 70s and then 60s here on Wednesday. And with that, we'll see a mixture of sunshine and clouds. I really think we're going to be dry for the work week this week, but heading into the weekend, we're going to see the rain chances coming back up a little bit. So we're going to start at 48 in the morning in the city, but outside the city, it's going to be a little bit cooler than that. So cooler than average morning. Then we'll be up to around 72 in the afternoon. We will have sunshine at times, mixing in with just a few clouds. So that'll be a 10 on the wasometer. That's our scale from 1 to 11, where an 11 is a perfect day. Not a lot of action showing up here on the forecast track, and we kind of like that based on what we went through yesterday and last night with those storms. It's nice to have a quiet pattern here tomorrow. Mostly sunny to partly cloudy skies at times. And then in the late night hours, still really nice out there. And then even going into Wednesday, another good day with just that mixture of sunshine and clouds at times. No rain around, that northerly flow, keeping us just a little bit cooler with high temperatures. That'll be in the 60s. Now, as you look at the 7-day forecast in just a couple of seconds, we're going with lower rain chances on Saturday and Sunday. Now, the models are not in total agreement. This is the European model that is showing a little better chance for some showers. Now, for now, we're going with a 20% chance for showers on Saturday. But if this model holds true for Saturday and Sunday, we may have to bring those up a little bit. And as of right now, it doesn't look like that's going to be a real stormy system for the weekend, but just some rain chances that'll be going up. And then drier air as we head into next week as well. So tomorrow's high, 72 degrees, that mix of sun and clouds. Wednesday, maybe a few more clouds around mixing in, but you know, earlier we had like a really low rain chance for Wednesday. We've taken that out for now with highs near 66. Thursday morning, we start off at 43 degrees with a high of 70. That's going to be another chilly start. 48 Friday morning with a high of 75. And there's that low rain chance Saturday at 20%. And then for now, we're saying a 30% chance Sunday and Monday. We're going to wait to see how those models come together. We may have to up those chances a little bit as we go through the second half of the weekend and beginning of next week.
All right, thanks a lot, Chris. You know, overnight storms lead to flooded roads in some of our areas. Firefighters were able to help this driver in Dalton who was stuck in the floodwater. So if you're ever out and you see high water like this, firefighters say do not risk it. Just remember this phrase, turn around, don't drown. We'll be right back.
We'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today. A dozen ducklings and their mother are now swimming happily after being rescued from a busy intersection in Duluth. Officers with the city's department spotted the family trying to cross the road when the ducklings and the mother got separated.
So our officer tried to assist them crossing, and at some point some fell through the sewer drain. They were able to kind of surround them. Actually got with Banfield for the cage, and then also Firestone to help open up a grate to get the rest of the ducklings that fell. And then we relocated them to a smaller lake inside the city.
To see this full video, head to the My Lawrenceville News section of our website.
And here's a look at your 7-day forecast, where we have dry weather conditions here for Tuesday and Wednesday and Thursday and Friday with a mixture of sunshine and clouds. We will have a low rain chance as we head into the weekend, 20% chance Saturday, and then a 30% chance on Sunday and also on Monday, with those high temperatures that will be in the 70s as we go through the week. Now, just know we may have to be fine-tuning those forecasts. Some of the models are ramping up the rain chances again for at least Sunday and Monday, and we'll let you know if we have to do that. But for right now, we're holding off. We'd love to have a dry weekend, but we'll wait and see to see how the models are coming together for that with the rain chances for the weekend.
All right, Chris, well, we are going to see you on our sister station 11Alive for Up Late, and more news and weather coming up next on the ATL.
Your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions.
11Alive News Primetime on the ATL starts now.
Now 10 communities across the South are picking up the pieces after deadly storms. In Georgia, at least 8 people were killed. Nearly 50 others were hurt. The powerful storm, strong enough to rip a house off of its foundation and toss it into the street. Possible tornadoes tore through trees, leaving behind piles of debris. The damage prompted Governor Kemp to order a state of emergency in our state, making way for funding to help clean up and to rebuild. Good evening, everyone, on this very busy Monday night. I'm Jeff Hullinger reporting live from my home in town.
It is busy indeed. I'm Aisha Howard reporting from the 11Alive studios in Midtown. So tonight, hundreds of families across the South don't have a home where they can shelter in place because of those deadly storms. Natisha Lance takes a look at some of the hardest hit areas in Georgia.
Devastation at your doorstep. Toppled trees, uprooted homes, and debris tossed all around. In the middle of the night, this siren woke up people living in Upson County, warning them a tornado was on its way. Daylight brought a clearer view of the destruction.
Yeah, it was pretty scary. I mean, in a community like this, you wouldn't think something this big would happen.
Wind strong enough to rip trees from the ground and lift a home off its foundation, tossing it into the road.
We felt something pick us up and, just completely slam us towards the back side of the house.
In Murray County, Jordan and Harmony Ray are still in shock at the destruction. The storm tore through a community of mostly mobile homes. You can see them scattered among cars turned upside down. At least 7 people died in the county. Governor Brian Kemp got a first-hand look at the damage in Murray County Monday afternoon. During a news briefing, he said it looked like a bomb went off.
When you look at these, it's a miracle anybody lived through it.
We're blessed to be here, blessed that God had his hand over us.
And many of these communities were already hit hard by COVID-19, putting some of those residents out of work. But Governor Kemp is confident that Georgia will be able to rebuild what was lost.
Chief Meteorologist Chris Holcomb was in the 11Alive Storm Tracker Center early this morning, bringing everyone at home those very critical storm warnings. Chris, it was indeed a busy night. Glad you were here to get those warnings out.
I was glad we could be here, the entire Storm Tracker team, and we were just glad that we could get that information out to a lot of our viewers who were very anxious last night with these overnight storms. And we had numerous storms that were already confirmed last night when the tornado warnings were coming out. But then after the fact, the National Weather Service usually goes out and surveys the damage. It's going to take them a while to survey all the damage, but today they went to Bartow County. This is the preliminary rating that it was an EF1 with wind speeds of around 85 and 90 miles an hour. They'll come out later with the official report with the path length and the exact location of where it touched down. Murray County also classified as a tornado. This one they're saying was an EF2. This is up in northwest Georgia, and they're just saying a high-end EF2, and the EF2 wind speeds are usually between 111 and 135 miles an hour, so that was probably at the higher end of that range. We don't have a path length on that either, but that's the one where we had at least 7 deaths up in the Murray County area. Now, you can see around North Georgia, there were a lot of spots with reports of wind damage, hail damage, and even confirmed or observed tornadoes last night, and that's just all part of the same system that when we told you last week we were going to have a significant severe weather event over the southeast. Just take a look at all of these areas that had wind damage and even potential storm damage. Things are a lot quieter right now. Stay with us. We'll let you know what to expect for the rest of the week and when we'll see the next rain chance moving back in.
All right, thanks, Chris. So to track severe weather and get the latest forecast where you live, be sure to download the new 11Alive app. You'll get those alerts sent straight to your phone.
Now to the latest on COVID-19. Tonight, 13,621 people have been diagnosed with COVID-19 in Georgia. Of those confirmed cases, nearly 20% have been hospitalized. 480 people have died in Georgia from the virus. We talked about flattening the curve every day since this pandemic began. And the question is, are we beginning to see the positive influence of this? The first confirmed cases in Georgia were on March 2nd. Tonight, there are some signs that the rate of new cases in Georgia is slowing down. Now, if you take a look at the new graph from the Department of Public Health, you can see on the far right side how the most recent movement is not as sharp as in the previous weeks. And if we look at the numbers, the week of March 27th to April 4th, the state recorded more than 4,000 new cases. The next week, a little more than 2,500 new cases. And we want to make it clear, these are trends. The health department says we cannot reach too many conclusions because the data is very slow coming in and it is incomplete. Today, Governor Kemp gave an update on the response to the crisis, and he had this news conference around 4 o'clock today. When does he think that he might start lifting restrictions and reopen the state for business? It's something on everybody's mind. Here's John Sherrick with the top 3 headlines that you may have missed.
1. Today we have to stay focused on the mission at hand.
Georgia Governor Brian Kemp says he'll think about lifting stay-at-home restrictions and other restrictions only after Georgia gets past the peak of hospital cases, projected now to be on April 26th. Right now, he says he's focused on being ready for the peak, expanding hospital capacity to meet high demand, and stopping the alarming surge of cases in nursing homes and other long-term care facilities. 2.
Our testing numbers in Georgia continue to lag.
The governor has a word to describe Georgia still trailing most other states in coronavirus testing.
It's unacceptable.
So he said the state is now expanding who can get tested. From now on, for example, people who don't even show symptoms can get tested if they've been exposed to people who are infected. But Kemp said Georgia still does not have enough tests for everyone who wants it tests. 3, no one should let up now, he says. Not yet.
I will tell you, we are seeing some good signs. It's just time to hunker down, make sure we can get to the peak, flatten things out, and then start going the other way.
Start going the other way, the top priority, when the numbers of infections and deaths in Georgia are decreasing every day.
And that was John Sherrick reporting. A local father of 4 has died of COVID-19. Last week, we told you about 48-year-old Matt Lindsay fighting for his life in a medically induced coma. At the time, his ex-wife told us it pained her to see people outside not following social distancing guidelines. His family has started a GoFundMe to help pay for his cremation. It has already far surpassed its $1,200 goal. You can find that link on 11alive.com. Albany is one of the hardest hit areas in the state with the most number of deaths reported from COVID-19. It's also home to a large plant churning out a popular product these days, toilet paper. New tonight, Caitlin Ross talked to an employee who shared how the company is trying to slow the spread and meet those demands.
And the days are way different than they used to be.
John Pattison puts a mask on as soon as he gets out of his car. As a department leader at the Procter & Gamble plant in Albany, he's reporting to work with 600 other essential employees.
You come in and now we have our thermal scans after you badge in. So we're getting all of our temperatures taken.
If one person on a team at the plant gets sick, the entire team is quarantined. Pattison says the focus is on keeping people who work there healthy. Dougherty County has been hit hard by the virus, with one of the top infection rates in the state. Officials say the virus cluster is linked back to 2 funerals there back in February and March. Governor Brian Kemp addressed the outbreak in Albany Monday.
The Albany situation is just much drastic than anywhere else in the state, even though we've had other little smaller hot spots.
Pattison says it's been hard to adjust to losing the contact with people at work. Hard at home, too, where his wife has been furloughed and is home with their 5 children.
And help out at a distance, at arm's reach, versus really being able to go through this together. And that Southern hospitality has been lost.
He doesn't know when things will get back to normal, but takes pride in doing work that can provide people comfort and security. He says they're making it as fast as they can.
The Procter & Gamble plant has ramped up production 20% to try and meet the increased demand for toilet paper since the pandemic started.
Next, how Emory is using lessons from a past outbreak to guide its coronavirus response.
And check your bank account. Stimulus checks are rolling out, but if you didn't file taxes using direct deposit, when you can expect it next.
Workers and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both.
Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing
As the COVID-19 cases grow, so are the number of people getting scammed. Federal agents are taking notice and taking action.
As the federal government tries to slow the spread of coronavirus, they also want to stop COVID-19 scammers.
It's just a get-rich-quick scheme.
Homeland Security is now teaming up with Georgia's top state and federal prosecutors to crack down on these criminals.
Anytime you're looking at giving your money to somebody, you need to really be looking at, are there red flags?
Some schemes include fake cures and medicines that could do more harm than good. Special Agent Robert Hammer gives us one example of a fake vaccine.
However, it was nothing more than cotton infused with insecticide.
And even fake test kits. They're also claiming to have high-demand products like cleaning and medical supplies. But when you place an order, they take your money and run.
Portraying that they have millions of N95 masks, when in fact they don't even have those masks.
Charity scammers are asking for donations for fake nonprofits to help people affected by coronavirus and COVID-19 related apps that actually contain malware to steal your personal information. If you think you've been scammed, send your tips directly to the feds.
And we have a full team of agents that are dedicated to doing nothing but triaging that information as it comes in.
For information on how to report those criminals, we do have a link of investigators on our website from Ron Jones, who brought us that story. Just catch that at 11alive.com.
Georgia has seen a surge of COVID-19 patients. So far, there are more than 13,000 cases statewide with 480 deaths. But at Emory University Hospital, where they have taken care of 25% of the state's hospitalized patients, they have been preparing since December. Emory had the experience to know what was likely coming and how they needed to make sure that they were at least physically all set to go in terms of their organization. Tonight, NBC's Cynthia McFadden has an exclusive look into how Emory is using the lessons of a past outbreak to find answers during this pandemic.
It was summer 2014. Ebola was terrifying the world, and Emory University Hospital admitted the first Ebola patients in the United States. The courageous team of doctors and nurses miraculously saved the lives of all 4 of their patients. Fast forward to December 2019. That same team was watching Wuhan, China, and worrying.
It became clear that this was something that couldn't be business as usual.
Dr. Jonathan Lewin is CEO of Emory Healthcare. He says they went into high gear to be ready for the new enemy, COVID-19.
It had to be a much more serious, much more coordinated response as a health system.
The first step, preparing the staff. Everyone on the front lines, the doctors, the nurses, every tech, got trained on how to protect themselves, how to use the PPE they had on hand in very particular ways they had learned from Ebola. For example, you don't just take off your gloves, there's a safety protocol to it. Of course, they quickly realized they needed even more PPE, but getting it, especially face shields, was not so easy.
Our chair of biomedical engineering said, hey, this looks like it's going to be tough. Where are your biggest challenges? And we said, we're out of face shields. We can't get them.
The Emory team knew from Ebola a face shield is better protection than a mask alone. So they got creative.
Our biomedical engineers got right down to it, figured out how to design it. The rest of the engineering school over at Georgia Tech helped working on laser cutting the plastic, 3D printing the frames.
By March 1st, Dr. Lewin felt his hospital was ready for battle. So on March 6th, when the first COVID-19 patient arrived, Emory was ready, he says. Since then, the hospital says it's treated over 600 COVID patients. Dr. Colleen Kraft is one of the courageous doctors who battled Ebola here at Emory.
It's been a really packed day.
And is now fighting COVID. Her first COVID patient was the hospital's first patient.
I wanted to walk away. I had like an Ebola PTSD moment, for sure.
But of course, she didn't. Her hospital was ready, she was ready, and thankfully, the patient recovered.
The scale of this is so different than Ebola. I mean, Ebola containment worked, right? You just had to keep it in one place and never let it out. Amen. This has community transmission. We can't link all the cases to where they started. And so if that is the case, then that makes everything suspect and everything we touch suspect.
And yet, so far, the lessons from the deadly Ebola outbreak have served them well, helping them work ahead of the tidal wave, providing precious hope and expertise on the front lines.
Well, we've got a stretch of dry weather ahead of those storms yesterday. Chief Meteorologist Chris Holcomb has this week's forecast. Hi, Chris.
You know, I don't know about you, Aisha. I'm happy about this dry stretch ahead. I think we deserve it after what we were dealing with last night and early this morning. And we're going to have some pretty nice temperatures around as well. If you've been out tonight, I know you've noticed those temperatures falling after we made it into the 70s today for a high. Right now, we're in the lower 60s. That's here in Atlanta. We have mid 60s in Athens, lower 60s in Covington. On the north side, it is a little cooler. Also over to the west, 55 in Carrollton, mid 50s in Canton, and then those lower 50s up in North Georgia too. Those temperatures will continue to fall tonight. We have a few clouds out there, not a lot, but we'll just say partly cloudy skies. We'll be in the 50s though in the 11 o'clock hour and at midnight, lower 50s at 2 a.m. And then we're not finished falling yet. We're going to see those temperatures move into the 40s here by tomorrow morning, which is going to be a little bit below the average. We'll have a lot of sunshine though to start, and we will rebound pretty nicely during the day tomorrow. Eventually, our high temperatures make it back up into the lower 70s, right at about 72 degrees. We're going to go with a 10 on the wasometer. That's our scale from 1 to 11, where an 11 is a perfect day. We're rating it a 10 with these comfortable temperatures and sunshine. That'll just be mixing in with just a few clouds during the day. Here's the forecast track. I think you'll like this too, since we deserve a break from all of the rain and the storms that we had overnight, because we're not seeing a lot of action here where we have dry weather conditions in the morning, sunshine, just a few clouds that'll mix in at time. We're going to pretty much continue with that northerly flow, so we will make it into the 70s tomorrow, but it's going to be cool for the next few mornings. We're going to start off with temperatures that'll be in the 40s the next few mornings, and then afternoon highs tomorrow. Excuse me, that will be in the 70s. Then on Wednesday, we're going to see our high temperatures in the mid and upper 60s, which is going to be a little bit below the average for your Wednesday. And then moving into Thursday, feeling pretty nice too. Still starting off though that morning with that chilly air in place. We'll be in the lower 40s here by Thursday morning with afternoon highs that'll make it back up into those lower 70s. So here's the forecast model. Now, we looked at different models when we're coming up with our extended forecast, and then actually when you start moving farther away from today, like on day 5, day 6, day 7, a lot of times the models kind of diverge a little bit and they're not saying the same thing. And we have one model saying that the weekend is going to be dry. This model is showing a better chance for showers. So what we're going to be doing over the next few days is we're going to be looking to see how those models kind of start coming together a little bit more, and we'll be fine-tuning those rain chances. For now, I'm going with a low rain chance on Saturday, then a little bit higher rain chance here on Sunday, and then things will move out later in the day on Monday with another area of cooler air, northerly flow coming in into next week as well. So here's the 7-day outlook based on what I'm seeing right now with our model data. Really dry for the rest of the work week. Earlier, we had a 30% chance for a shower in for Wednesday. We've taken that out now. I do think we'll have a few clouds around, but I'm not concerned about rain. It'll be a little cooler though at 66 degrees. But there you see those cool mornings with temperatures that start off in the 40s, then afternoon highs in the 70s for Thursday, Friday. And here comes that low rain chance Saturday, 20%, 30% chance Sunday and Monday. But we'll be watching those models. Just know that this is not set in stone. we may have to bring those rain chances up a little bit more as we head into the weekend and also the beginning of next week. Check out our weather wow moment for the day, and this takes us back to more storm coverage. This is just from next door in Alabama. Drone video showing the aftermath of a tornado that swept through the area of parts of Alabama yesterday in Carbon Hill. This is where this was yesterday. You can see the homes destroyed there. Debris scattered through the streets. Preliminary storm survey shows evidence of an EF1 tornado in this particular part at Carbon Hill with maximum winds of about 100 miles an hour. We would love for you to be part of our 11Alive Storm Trackers group. That's where we get a lot of our videos and pictures of the Weather Wow moment. On Facebook, just search 11Alive Storm Trackers. Ask to become a member. It's a closed group. We'll approve you though if you're a real person and you answer our questions. And we'd love for you to be a part of this fun weather community.
Coming up in the next half hour, she hasn't left her home in weeks, but she still contracted COVID-19. How she possibly was impacted.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
They are the heroes amid the coronavirus pandemic. The doctors, nurses, healthcare professionals, but also the grocery store clerks, truck drivers, and sanitation workers. And one Gainesville woman is especially thankful for a few garbage truck drivers who went the extra mile. Joan Sheffield says she was cooking dinner for her husband last week when she stuck her wedding rings in her pocket for safekeeping. The rings, which she had worn for 34 years, accidentally made it in the trash. In a panic, Joan called the city's solid waste department. The waste crew stopped their route and met her at the landfill.
The drivers came up and they were so nice and so thoughtful, and they said they were so sorry, and I said, "You're sorry." I sifted through most of the earlier bags, and it caught my eye, this green twist tie, and sure enough, there were 4 or 5 smaller bags in there, and the third one was the charm. I found it.
Joan says she's so thankful for the waste crew's help and has promised to take them to lunch once the shelter-in-place order is lifted, of course. Well, time for me to head out to get ready for Up Late. What a sweet note to end on tonight. I will see you on 11Alive coming up in about 35 minutes. Jeff, I leave it to you.
Aisha, thank you. That is a sweet story. We appreciate it. Have a good broadcast tonight. We'll look for you on 11 Alive in about 35 minutes. Here's what's coming up on the Big 36 over the course of the next half hour. A grandfather lucky to be alive after a tree came crashing down during severe weather. It was just feet away from his bedroom. His story is coming up next.
Footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Seven people were killed in Murray County overnight when what is suspected to be a very large tornado struck. Doug Richards was there as Governor Kemp toured the damage today.
This is a sample of some of the destruction here in Murray County from what residents and officials say was one and perhaps more tornadoes that struck here overnight.
And their trailer was over there and it blew them over here.
In this hilltop community,
God was watching them.
There was destruction as far as the eye could see.
There used to be a double wide sitting right here.
It was a storm that seemed to target a community composed mostly of mobile homes, dwellings that often lack staying power in the face of a tornado.
There's been a lot of people died in this.
Residents and officials had counted 7 casualties by midday, including the 2 women who lived in the house that had been fastened to this brick foundation. Rebecca Beck had been sheltering in place. Her daughter told us the storm took her life.
Y'all hang in there. God bless.
Governor Brian Kemp was among those surveying the damage, adding to the ongoing state of emergency experienced by the entire state. This community got what Kemp called a double whammy.
One guy just told me they didn't have any, wasn't anywhere he could go. They just had to make the best of a bad situation. But it is, when you look at these, it's a miracle anybody lived through it.
This is our house right here, and it used to be right down there. They picked it up and flipped us around or something. The tool shed, of all things, is still standing.
Miguel Castillo was with his sister and her 2 small children inside a house that suddenly went airborne.
We were honestly afraid it was going to come back. I mean, I don't know how these things actually work. We've never been in anything like this, But truly, God was with us, I mean, I wish others were more fortunate.
The recovery here in Murray County is only beginning. It is expected to go on for months.
So from Murray County, we go to Bartow County. Preliminary reports are showing an EF1 tornado struck there. 34-year-old William McConnell was killed. He was sleeping in his home when a large tree fell on his house. He never knew what hit him. Mara Siriani spoke with one of his neighbors.
Deadly storms across the South claiming 1 life here in Cartersville. Fire officials tell me a man was fast asleep when a tree fell on his home, killing him. Around 1:15 this morning, the time when the storm was at its worst in Cartersville. Relentless rain and wind bringing down this massive tree onto a home along Fight Street. Inside, neighbors say a family who had just moved in not long ago. Fire officials confirm a 34-year-old man was killed while sleeping in his bed. Other people in the home at the time were able to escape with only some minor injuries. Fire crews spent much of the early morning hours cutting limbs and securing the structure. Fire crews say this is by far the worst damage in the area, a horrible accident as a result of the storm. And authorities here in Cartersville say thankfully there were no reports of any other injuries.
In World War II, Americans were asked to use their skills and talents to support the war effort. And today it's a different kind of conflict. And like the 1940s, the contemporaries there, many stand ready to answer to call to do what is the best for the collective. It is not easy to do.
This is a big deal because antibodies are part of the way our body fights off a virus. And if scientists and doctors can figure out which ones protect against this virus, it could be the key to finding a treatment. I was briefed by Dr. Anish Mehta in a Zoom call this morning.
It's a real landmark achievement.
He says it's a simple blood test. All it takes is 1 vial of blood to find out if someone has had the virus, no matter how severe or mild their symptoms. This alone will be helpful in figuring out how widespread this virus really is. Once they send the blood to the lab, Emory says they'll be able to get results within 24 hours. Right now, it's only available to Emory patients, healthcare workers, and employees, but they plan to offer it to the public down the road.
As we move forward, our Emory Medical Labs is really looking to scale up this test and hopes to reach a goal of being able to do 5,000 tests per day, hopefully by mid-June.
So what happens next? If they find out you have antibodies that protect against COVID-19, Dr. Mehta says they might invite those people back to collect more blood, to gather antibodies and plasma, and use it as a potential therapy for people who are still sick.
This test, I think, is going to be vitally important, not only to identifying people who've become infected, but also as we offer it to a broader audience, be able to really detect the impact COVID-19 has had in communities.
There's no specific timeline on when this will be available to the public, but Dr. Mehta says they're working on ways people could potentially do this test at home. They hope to have an update on that in the coming weeks.
State reports now are identifying several hot spots that are existing in Georgia right now, and state officials have been able to target in on these hot spots by taking into account those counties' population. Here's Joe Hankey to explain.
For weeks, Phoebe Putney Memorial Hospital in Albany battled a constantly increasing number of patients. Phoebe's chief medical officer updated Dougherty County leaders Friday.
That number no longer appears to be increasing at this point and does appear to be flattening to some extent. No time to let the foot off the gas.
Doherty and many nearby counties are leading the state for cases based on their population. These 20 highlighted counties, the vast majority in southwest Georgia, have the highest rates of confirmed COVID-19 cases based on new data from the Georgia Department of Public Health. All of these counties have 200 to around 1,700 cases per 100,000 people. Compare this to Fulton County, where there are nearly 1,600 confirmed cases, the most in the state for a single county. But based on population, there are only 147 cases per 100,000 people in Fulton.
You know that we are the hot spot.
State Representative Gerald Green represents several of the hardest hit counties.
We've never lived through something like this. They're thinking it doesn't happen to me.
Green says that was the attitude for weeks. People continued to attend funerals, disregarded social distancing, and did not limit the amount of people attending. He heard of a business holding a grand opening and drawing a crowd. And similar to the metro area, Green says the National Guard needed to clean out several nursing homes.
In nursing homes, we've seen a tremendous volume of the virus.
But now across the area, he is starting to see fewer people outside and more people wearing masks.
Tragedy of all this is finally making people realize that it could happen to me.
So here's a correlation to World War II, as I was talking about a couple of moments ago. But let's sort of begin this anew. You're talking about people coming together as one. Very difficult to do. It was tough back in the 1940s, and even more so now as Americans' population has certainly become significantly larger. But trying to do what's best for everyone is something that has been the goal of everyone.
So the whole class is about finding a problem in your local community and trying to solve it.
Maddie Anderson works at the Weber School in Sandy Springs, a fabrication lab manager in the school's Daniel Zalick Academy. She wanted to aid in the battle against COVID-19. Then she heard someone was looking for help to build intubation boxes, a key form of personal protective equipment physicians use when treating patients suffering from respiratory issues that stem from coronavirus.
We had seen the box or some diagrams on the web and had reached out to area schools.
Maddie jumped at the opportunity.
I immediately called them and got in touch with them, and they were saying, well, we need as many as you can make.
They would settle on 21 boxes. Family and friends donated money. Personal contacts within the Home Depot helped connect the group to local vendors. Maddie assembled her team and got to work.
We are able to do quite a bit of manufacturing on our own, but honestly, assembly is the longest part, and that takes the most time.
Through patience and persistence, they accomplished the mission. 21 intubation boxes that will be delivered to 10 Wellstar Healthcare System hospitals. Doctors there will provide feedback. For the team, it's a success. For Maddie, a source of relief.
My mom works in healthcare, and so hearing about, there's a lack of protective gear, and the numbers are getting higher than we expected. And so for me, it was kind of coming from a personal place of, I'm anxious, I want to help my mom.
Stepping off the sidelines to save those who sacrifice on the front lines.
You want to check your bank account? Americans are starting to receive their coronavirus stimulus check payments via direct deposit. The first payments went out on Friday. The checks are part of a $2 trillion bill to stimulate the economy. For those who do not have direct deposit information registered with the IRS, it could take months for checks to arrive in the mail. Senator Bernie Sanders has officially endorsed Joe Biden for president. The announcement came during a live-streamed conversation on the economy. Senator Sanders suspended his campaign last week, effectively making Joe Biden the Democratic nominee to take on President Trump in November. Last week, Georgia's Secretary of State Brad Raffensperger moved back the primary to June. June 9th is going to be the date because of COVID-19. It's the second time that this has been forced to occur. Primaries for U.S. House members, one Senate seat, and multiple state seats are also set for June 9th.
To the current health emergency, members of the public are reminded to keep a safe distance.
Police in Savannah are using drones to enforce social distancing. The drones are being used to warn people who are too close together to separate. Police officers say the drones allow them to cover more ground since they can fly up to 100 feet in the air. A woman who hasn't left her house in more than 3 weeks thought she did everything right, but she still tested positive for COVID-19. Next, a look at how she may have been infected.
We're keeping an eye on radar tonight, not because it's raining, because we just love watching that scan showing nothing going on. Stay with us. We'll let you know if we see additional rain chances moving our way as we go toward the end of the week and even into the weekend.
Coming up, the XFL filing for bankruptcy. We speak with one player and former Georgia Bulldog about how this impacts his future career. That's coming up next in our sports segment.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and...
This is one of the more troubling stories of the day, and quite frankly, one that certainly has caused a lot of conversation in homes in a lot of places. A woman in Charlotte has not left her house in 3 weeks, and yet she still tested positive for COVID-19. How could that be? How could that happen if she wasn't exposed? She clearly was. Rachel Brummert says she has an autoimmune disease, and she listened to the advice of experts early on. She took one trip to the pharmacy weeks ago and has only been in contact with a very few people. Her husband is living in a different room of the home. She received a couple of packages. There was also a person who delivered groceries to her doorstep. She says that person later tested positive.
And I barely had any contact. I mean, I didn't even touch her. From what I'm hearing about ventilators, it's scary stuff. I really hope that I could just wait this out at home.
Experts say people with the coronavirus, very contagious, even before they start showing any symptoms. But Brummer's story shows how hard it can be to trace back the line of infection. And even now, she is not 100% who gave it to her. Metro Atlanta largely spared extensive damage from the storms last night. There were some trees down, but by and large, we got off pretty lucky for the most part. Deborah Tuff spoke to a grandfather in southeast Atlanta who feels he is fortunate to be alive when a big tree fell on his property, but certainly not onto his house.
I heard the thunder and the lightning, and then I heard something hit the house.
That big bump, a big tree in Mr. Benny Brown's front yard. The 80-year-old who celebrates a birthday next month was watching storm coverage in his southeast Atlanta bedroom. He didn't think that storm would knock on his front door. We interviewed him by phone.
I thought it was a limb fell on the house. I didn't realize it was a tree. So my next door neighbor called me and told me to look out front.
Car crushed, limbs everywhere, shingles probably damaged Mr. Benny's grandson, among a steady stream of folks coming by to make sure he's okay.
It's not a large home. He could have easily been impacted way more than he was, and that's what I was saying. That's the biggest blessing. The fact that, the entire front yard is gone.
His water runs, his electricity is on, but there's this one nagging problem. The large tree that's crushed his car. Mr. Benny says he called the insurance company, but says they won't be coming out to get the tree or fix the damage anytime soon.
When I talked to the insurance company this morning, due to the crosses, everything slowed down, and they said they would get back in touch with me, and that's it. I haven't heard from them.
I travel from Jonesboro, so I've seen a lot of different trees on the ground. I think if they were able to actually see it, put eyes on it, I think that they will be able to see, how severe it is, and maybe they'll, kind of, put a rush on, coming out.
Well, the day after the storms or following the storms, since they were really overnight last night and early this morning, we really started to improve with weather. As on the backside of this system, we had some drier air moving in and some sunshine. And unfortunately, a lot of times what happens with these storms, it'll be a crazy night. And then when folks are, or a crazy day, and then when folks are cleaning up the next day, it's usually a bright, beautiful sky. And that's kind of what we had today. A few clouds were mixing in. Temperatures today made it up to 74 degrees. We should be around 72 for this time of year, so a couple of degrees above the average. And our low this morning was 60. That was a little bit above the average. We should be starting off around 51 for this time of year. It wasn't that cool though this morning because we were still dealing with those clouds and that rain as it was pushing out, so that's why it was a little bit milder. We had about 3/4 of an inch of rain since midnight last night, so that's bringing our surplus back up a little bit. We're close to almost a foot above average in rainfall so far for this year, and it looks like those numbers of the average are going to start coming down a little bit. Of that surplus actually will start coming down a little bit because we're moving into a drier pattern and we don't expect to see much in the form of rain that'll be moving our way. Watch these temperatures tonight. We're in the lower 60s right now. Next hour we'll be in the 50s. We'll be in the 50s until about 2 o'clock, and then we drop into the 40s. By tomorrow morning we're going to start off with those temperatures in the mid and upper 40s depending on where you are. It'll be mainly clear, and then just a few clouds will be mixing in with the sunshine at times during the day tomorrow. So here's what we're watching with the weather headlines for this week. Pretty much every morning, we're going to have some cool mornings with temperatures generally there in the 40s, but in the afternoon, it's going to be kind of comfortable. We'll be close to average on Wednesday, just a little bit below the average, and through the week, we're also going to see a mix of sun and clouds. But at this point, we're not calling for any rain for the work week, so that's going to be pretty good for us. The problem is going to be when we head into the weekend. Models are not totally agreeing on the rain chances. I do think we'll see some showers. We'll be fine-tuning those rain chances for you as we continue to get closer to the end of the week. But here you go, dry pattern moving through the rest of the the next couple of days here. On Wednesday, maybe just a couple of clouds around, a cool start in the lower 40s here on Wednesday. And then afternoon highs Wednesday will only be in the 60s, but then we rebound back up into those 70s. But still those cool mornings each and every morning. We're calling for those temperatures that'll be in the 40s. Afternoon highs tomorrow at 72, but only 66 on Wednesday. Back to 70 Thursday, 75 Friday, and there you see those rain chances. Right now on the low end for the weekend, but we'll keep an eye on that to see if we have to bring those up.
Well, many are struggling during this time, making ends meet, and now the sports world is not immune to that struggle as well. The XFL, which began with so much promise, really a victim of bad luck and bad timing. They have laid off a lot of employees last week, as you remember, and as Maria Martin tells us, players are now looking for new jobs.
They signed a letter Friday basically saying that was our last paycheck, and that was pretty much just laying us off.
On Friday, the XFL laid off almost all of their employees, and today, ESPN is reporting the new football league has filed for bankruptcy.
They told all the guys that we should file for unemployment and to keep up with the lost wages.
As far as getting paid,
they came out today understanding that they paid us for the rest of the season, which wasn't the case. They owed us a lot more checks.
And it's not just former Georgia defensive tackle Toby Johnson that's affected, but the employees who shared the love for football.
A couple of our equipment managers, they left. They had real jobs, and they left that stuff to come, to really be with us, to help us, build something special. My heart just go out to them.
For now, Johnson, who has made several practice squads in the past, is working to get back to the NFL.
How many teams have reached out to you? How many NFL teams?
I think more like 7 or 8. And my agency talked to a few more to come down.
And even though he's not returning to the XFL, he still thinks they had something special in the making, despite no plans for a 2021 season.
You actually see a lot of behind-the-scenes stuff that most of the time, you play in the league, they don't nothing leave the locker room. Nothing. Not a press conference, nobody getting everything so political, and you don't get the chance to know the real player. And the XFL, you got a chance to see everything.
NASCAR has suspended driver Kyle Larson for using the N-word during an iRacing event on Sunday night.
Kyle, you're talking to everyone, but yeah, we heard that.
Honestly, when I heard the news, I wasn't surprised. As someone who plays video games online, if you do, you probably can relate to this. I've heard slurs from strangers many, many times before. It's one of the more unpleasant things about playing video games online. But Kyle Larson represents NASCAR.
Yeah, I just want to say I'm sorry. Last night I made a mistake and said the word that should never, ever be said.
He has no business saying the N-word, so for that reason, I think that NASCAR's punishment was fair.
We continue honoring the class of 2020, those high school seniors who were unable to complete their athletic seasons. We give a shout out tonight to Westlake High School. Here is Alex Glaze.
I'm Carl Green. I'm the Director of Athletics at Westlake High School. This class of 2020 was very talented. We're trying to make their own history. Our girls basketball team, we had 3 members of the senior class. They were a part of the team that won 3 times in a row. Also in the top 25, we have about 5 athletes who are part of the top 5% of the class. Track was potentially thinking about trying to win it again. The baseball team was off to probably their best start in school history. We also have a star senior. If you look at the billboards all over South Fulton, Aaron Johnson, senior tennis player. My principal, he's always trying to do creative ideas. It's actually for the entire senior class. Like I said, they recognize them. They always have rich traditions, and this class of 2020 is not going to be remiss of not being a part of that rich tradition.
All right, that's it for sports. We'll take a break. We're back right after this.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both.
Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of
We are going to see a quiet weather pattern as we go through the rest of the work week, and I think we deserve it after we started off with this morning. It's going to be around 72 tomorrow for a high, and then we're going to have some cool mornings with temperatures in the 40s the next few mornings. Wednesday's high only at 66, back to 70 Thursday, and then we see the rain chances coming back for the weekend. Right now, doesn't look like storms, but a few showers around with temperatures in the 70s. Up late is next on 11Alive.
Who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both.
Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every
Looked like a bomb went off.
Late night terror as tornadoes cut paths of destruction through multiple Georgia communities. Some of our neighbors had their lives changed forever. And more testing. The governor says Georgia needs it, the latest steps in the state's battle against the coronavirus. And politics.